Doctor, is it true that the best treatment is prophylactic? Yes, that is true. Antibiotic therapy and the establishment of adequate drainage of the suppurative focus in the ear have lowered the incidence of otitic meningitis within the last 2 decades. Doctor, once the disease has developed, what is the next treatment? It is vigorous treatment which must be instituted to combat the infection, prevent ventricular blocking, and maintain electrolyte balance and nutrition. Doctor, what is the auditory external meatus? The external auditory meatus is a foreign body in the external auditory meatus, and it is called the papilloma. What about otoscopy in this case? Did you do that? Yes, I did otoscopy with removal of the foreign body. There was an excision of the papilloma. Doctor, was there a removal from the ear? Yes, the plastic repair of the ear followed. There was endoscopic examination of the external auditory meatus for removal of the foreign body or lesion. Doctor, and that is the middle ear? Well, the middle ear is the otitis media, which is an acute area. And did you do paracentesis? Yes, according to my medical record, there was paracentesis or puncture of the eardrum and evacuation of the fluid from the middle ear. Was there a myringotomy? Yes, myringotomy, which is incision of the eardrum and drainage of the middle ear. Doctor, there was a perforation of the eardrum, was there? Yes, but it was chronic. I did a myringoplasty, which is a reconstruction of the eardrum. And the middle ear and mastoid? Well, the otitis media acute resulted in a mastoiditis, which was a complete mastoidectomy. The scooping and obliterating of infected ear cells and the removal of diseased mastoid processes. Doctor, what about the middle ear? Well, there was a mastoid which was chronic. The otitis media was chronic also, as well as suppurative. The radical mastoidectomy, or modified radical mastoidectomy, was a repair of the middle ear. The tympanoplasty resulted in an end-oral approach to the temporal bone and thorough removal of diseased tissues. Surgical creation of a new cavity composed of healthy mastoid tissue, the tympanum, and external auditory meatus, or canal. Doctor, what is the mastoid? Well, in this case, there was an inflammation of the mastoid called mastoiditis, which was chronic, and also a perforation of the pars tensa. And the tympanoplasty, with or without mastoidectomy, is a closure, is it? Yes, a closure of the perforation by skin graft or vein or fascia or perichondrium. And the middle ear had an otosclerosis? Yes, a conductive deafness with fixation of stapes. And these stapes were mobilized, were they? The stapes mobilization operation was done. There was a stapedioplasty, which is a surgical opening and loosening of the stapedial footplate, as well as a removal of stapes and insertion of delicate prosthesis to replace the stapes in the ear. Doctor, was there a vein plug stapedioplasty? Yes, and this removal of the entire stapes, as well as insertion of the vein plug, creation of an arthroplasty for intact sound conduction. Was there a fenestration operation? Yes, the fenestration operation of the oval window, which is a removal of the stapes and footplate, creation of a new oval window, and replacement of the stapes. Doctor, I have not mentioned the internal ear. No, Meniere's disease, which may be unilateral, results in a labyrinthectomy. This labyrinthectomy can be end-oral or post-oral in the inner ear. Was there an exenteration? Yes, an exenteration of the ear cells, as well as an avulsion of endolymphatic labyrinth. Was there a removal of ear cells, doctor? Yes, a destruction of membranous labyrinth. And the bilateral Meniere's disease that resulted in an ultrasonic surgery, a selective destruction of osseous vestibular labyrinth by ultrasonic waves, avoiding bombardment of the cochlea. Doctor, what about the vestibulocochlear nerve? That is the acoustic neuroma or excision of the neoplasm. Removal of neoplasm, which involved some area of the neural passageway of hearing, was in order to avoid bombardment of the cochlea.
That was hard. That was hard.